Now we're going to talk about depression and repetitive behavior. Before we talk about depression as one of the symptoms of the signs that you will see in someone with dementia. Depression can happen at any stage of the dementia process. It can happen at the initial stage, the middle stage of dementia, or the late stage of dementia. But what is significant about depression is that the symptoms or the signs, they overlap. And it is very important to know, to understand the symptoms of dementia and the symptoms of depression, so that when someone with depression or someone with dementia has depression, it can be treated. Unlike dementia, depression is treatable. So it is important to understand and to know the symptoms of depression so that it can be treated. Once this is treated, then you eliminate one problem. One way of understanding depression in the elderly is you're going to see some new behaviors. For example, the person is suddenly sad. This has a personable personality, but all of a sudden they become sad. Or they just have like lack of interest in activities or social isolation. They just become withdrawn. There may be changes in their sleep pattern. They may have appetite changes, or they may become agitated or irritable. They may also be restless. They may have lack of energy, fatigue, and may have guilt or expression of worthlessness. They may have repeated thought of death or suicide. And how do we treat, or what are the benefits of treating depression? When you treat depression, at least you eliminate one problem. People with dementia, they may not be able to tell you what is going on with them, but when you understand and you are cognizant of new behaviors, especially of depression that can be treated, it goes a long way in enhancing their quality of care. When you treat depression in a demented individual, someone with dementia, you enhance their quality of life because you elevate their mood. Not only that, it also reduces the caregiver's burnout. It makes them to be more functional and creates independence. And it also remove possible contributions to memory